Okay, we'll go to the next question, doctor.
Ma'am, my name is Akshay. My question is the infertility treatment is expensive?
Infertility treatment, this is a very common notion that everybody has about infertility treatment as such. The first thing that anybody might say when you're talking about infertility treatment is about the expense part. But we must first identify the main scenario in which not all infertility treatment is expensive. And moreover, expense comes secondarily. As I said, it is a time that is the most important thing. There is a time to sow, there is a time to reap. Similarly, there is a time for infertility, and you have to be very quick and very time bound in this infertility practice. When you're talking about cost, when a couple goes through the infertility management, there are many times when just after the basic investigations are being done, there might be only a small variation in some of her blood hormones, a big thyroid, or a minimum problem with sperm problems, which can be evaluated and can be treated at a very minimal cost. So you cannot blanket a statement like all infertility treatments are expensive cannot be made. There are many a time we encounter very small issues that can be taken care of very easily. And there are other treatment in infertility like intrauterine insemination, in which the sperm of the husband is processed, that is the pus cells, the dead sperms are removed, and the most viable portion of the semen is collected, and it's passed through a catheter into the uterus, and that is called intrauterine insemination, where you are inseminating the husband's semen. So that is another treatment option that is very much useful and helpful in infertility cases, and in these cases it may not be that expensive either. Also, there might be cases where the couple needs to go through laparoscopy or hysterolaparoscopy or fertility enhancing hysterolaparoscopic surgeries, and that too in per se might not be that expensive and might take care of a lot of issues that the couple has. It is only after these steps fail that we as infertility specialists think about IVF or artificial reproductive techniques. Artificial reproductive techniques are not the first line treatment, they are the third or probably the fourth line treatment after evaluating a couple. So every couple is a separate unit, and we need to individualize the treatment according to the couple. And as a blanket statement, infertility treatment as such is always expensive, may not be acceptable. Yes, artificial reproductive techniques are expensive, but that is, as I said, the third or fourth line treatment, which we consider in a couple only if all the methods have failed and the couple has no other chance. Yeah.
Doctor, can you just explain more about IVF or artificial?
IVF and it's in vitro fertilization, or if we talk about ICSI, it's called intracytoplasmic sperm injection. That all those come under the broad spectrum of artificial reproductive techniques, or ART. ART has a lot of techniques, of which one is IVF, one is ICSI, one is ZIFT. There are a lot of techniques that are being done. In IVF, what happens is that by using this technique, we are taking the eggs out of the female, out of the woman, out of the wife. We are taking the sperms out of the husband. In an artificial environment, the sperm is injected into the uterus, into the egg. The embryo is formed in the lab, and that embryo is seen, and the good quality embryos are transferred back into the uterus. So it's a condition where it's a physiological condition is being done in a in vitro setup. But there are a lot of ethical aspects involved in IVF treatment, and always we need to be very particular that the eggs that are being used and the sperms that we are using are of the same couple, and definitely a lot of ethical issues are involved, and a lot of malpractice definitely should be avoided in this particular case scenario.
Okay. In such cases, how long will be the treatment?
Infertility, the particular treatment as of ART, of IVF, is just in a particular month. Probably there might be the preceding 1 or 2 months, we might need to prepare the couple, we might need to do their basic investigations, we might need to give hormonal control for the wife for cycling, and the treatment per se of in vitro fertilization is just 1 month. It's just a particular month that we decide, and that we start off with the investigations, and on that particular month we start injections for the wife. The injections are being given to make the eggs grow larger in size, and to increase the yield of the eggs. High dose injections are being used where more eggs are collected, and when all the eggs are ready, then we collect the eggs as we said earlier. The eggs are collected, then the husband's sperm is collected, the sperm is injected into the egg, the embryo is developed, and the embryo is transferred back into the uterus either on the 3rd day or on the 5th day. So, have to wait for another 2 weeks after embryo transfer to see for the blood test, and if the blood test is normal, it means that she has conceived. So the treatment as a whole for IVF will last for a period of around 1 month only.
So doctor, it was really informative. Thank you so much. So guys, write your suggestion to us. Our email ID is youthdiaryroseball@gmail.com. See you next week.